Knee replacement surgery, also arthroplasty, helps relieve pain and restore function in badly sprained knee joints. The procedure involves cutting away damaged bone and cartilage out of your thigh bone, shin bone and kneecap and replacing it with an artificial joint prosthesis manufactured from metal alloys, high-quality plastics and polymers. In deciding whether a knee replacement is right for you, a pediatric physician assesses your knee's range of motion, stability and strength. X-rays help ascertain the level of harm. Your doctor can choose from a variety of knee replacement prostheses, weight, and surgical methods, considering your age, activity level, knee form and size, and overall well-being. Knee replacement recovery time. Most patients can care for themselves and resume normal activities within 6 months and drive over 3 to 6 weeks. It may take 4 to 6 weeks or up to an entire year to completely recover and realize the total benefits of knee replacement surgery. When you leave the hospital, then you should be able to go around using a walker or crutches. But you'll want a person till you have more energy and can go around better or to assist you. You may go to a rehab center for therapy if you need more extensive care. You may go home with staples and stitches, a bandage, tissue glue, or tape strips. Change the bandage as your doctor tells you to. If you have staples or stitches, they will be removed by your doctor 10 to 21 days following your surgery. Tape or paste strips will fall off as time passes on their own. You may have some annoyance that is mild, and the area may be swollen after operation for 3 to 6 months. Your knee will continue to improve for 6 to 12 weeks. You then use crutches and will use a walker for 1 to 3 months. When you're prepared, you may use a cane. You will most likely be able to walk in 4 to 8 weeks by yourself. You'll need to do months of physical rehabilitation, rehab, after a knee replacement. Rehab will help you strengthen the muscles of the knee and also help you recover movement. Your knee will make it possible for you to do daily activities without pain and no pain at all, once you recover. You dance, could have the ability to increase, ride a bicycle, and play golf. Speak to your doctor about whether you are able to do activities. Always tell your caregivers that you have an artificial knee. How long it will take to walk by yourself, return to normal activities, and go back to work is dependent upon your health and how well your rehabilitation rehab program goes. The more you do with your exercises, the faster you will get movement and your strength back. This care sheet offers you a general idea to recuperate. But each person recovers at a different rate. Adhere to the steps below to get activity for knee replacement patients. Activity for knee replacement patients. Rest if you feel exhausted. You might take a rest, but don't remain in bed all day. Use a chair if you sit. You are able to use the arms that will assist you to stand up. Function with your physiotherapist to locate the ideal approach to work out. Everything you could do as your knee fixes will probably be dependent on if your knee is cemented or uncemented. In case your knee is uncemented, you might not have the ability to do things. Following your knee has healed enough, you are able to perform more strenuous tasks with care. You can golf, however, use a golf cart, and don't wear sneakers with spikes. It is possible to bicycle on a level street or on a stationary bicycle. Prevent biking up hills. Your physician may recommend that you steer clear of activities that place a strain on your knee. These include tennis or badminton, squash or racquetball, contact sports such as soccer, jumping, like in basketball, jogging, or running. Prevent activities where you could collapse. These include mountain biking, skiing, and horseback riding trails. Don't sit for at least 1 hour at one time. Get up and walk about for some time until you sit. Prop your leg up with a chair or footstool, if you have to sit for quite a while. This can allow you to avoid swelling. Ask your physician when you're able to drive again. It might take around 8 weeks following knee replacement operation before it's safe for you to push. If you enter a vehicle, sit on the edge of the chair. Pull your thighs, and then turn to face front. You ought to have the ability to perform many regular activities 3 to 6 months following your surgery. You will have to take away from work. It is based upon the sort of job you do and the way you're feeling as soon as it is possible to return to work. Ask your physician when it's okay that you have sex. Don't lift anything heavier than 5 kilograms and don't lift weights for 12 weeks. Diet for knee replacement patients. Diet for knee replacement patients. From the time you leave the hospital, you should be eating your normal diet. If your stomach is upset, try low-fat foods like rice, chicken, toast, and yogurt. Your doctor may suggest that you take iron and vitamin supplements. Drink lots of fluids, unless your doctor tells you to not. Eat healthy foods, and watch your portion sizes. Attempt to stay at your ideal weight. Too much weight puts strain on your knee, which is new. You may notice that your bowel movements are not regular right after your surgery. That is common. Try to avoid constipation and straining with bowel movements. You may want to have a supplement daily. Ask your doctor about taking a laxative if you have not had a bowel movement following a couple of days. Medicines for knee replacement patients. Medicines for knee replacement patients. Your physician will let you know whether and when you are able to restart your medications. He or she will also provide you with directions about taking any medications. Should you take aspirin, another blood thinner, ask your physician if and when to begin taking it. Make sure you know just what your doctor wants you to perform. Your physician may provide you a blood thinning medicine to prevent blood clots. If you take a blood thinner, make sure that you get instructions about how to take the medicine. Blood thinners can cause significant issues. This medicine could be in pill form or as a shot injection. Your doctor will tell you how to do this if a shot is essential. Be safe with medications. Take pain medications exactly as directed. If the physician gave you a prescription medicine for pain, take it. If you are not taking a prescription pain medication, ask your healthcare provider if you can take an over-the-counter medication. Plan to take your pain medication 30 minutes prior to exercises. Then to prevent it after it has started. Before it starts, it's a lot easier to prevent pain. If you think that your pain medicine is making you sick to your stomach, take your medicine after meals, unless your doctor has told you not to. Ask your doctor for a different pain medication. If your doctor prescribed antibiotics, take them as directed. Do not stop taking them just because you're feeling better. You need to select the full course of antibiotics. Incision care for knee replacement patients. Incision care for knee replacement patients. If your doctor told you how to care for your cut incision, follow your physician's directions. You will have a dressing on the cut. A dressing assists the incision heal and shields it. Your physician will tell you how to look after this. In case you didn't get instructions, follow this general guidance. If you have strips of tape onto the cut the doctor left, leave the tape for a week or two until it falls off. When you have staples or stitches, your healthcare provider will tell you when to come back to have them removed. If you have skin adhesive on the cut, then leave it on till it drops off. Skin adhesive can also be called liquid or glue stitches. Change the bandage every day. Wash the area daily with warm water, and pat it dry. Do not use peroxide or hydrogen peroxide. They can slow healing. You will cover the area with a gauze bandage whether it oozes fluid or rubs against clothing. You can shower 24 to 48 hours after the operation. Pat the incision dry. Do not swim or have a bath for the first 2 weeks, or until the doctor tells you it is fine. Exercise for knee replacement patients. Your rehab program will provide you a few exercises to do to help you get back your knee's range of motion and strength. Do them your therapist tells you. FAQ about knee replacement patients. How long does it take to walk after a full knee replacement? You will probably be in a position to walk on your own in 4 to 8 weeks. You will have to do weeks of physical rehabilitation, rehab, after a knee replacement. Is a total knee replacement painful? After total knee arthroplasty (TKA), pain severity plateaus at between 3 and 6 months after surgery, 11, 12, and therefore chronic pain after TKA is best defined as pain that is current and bothersome at least 3 to 6 months following surgery. Is walking good after total knee replacement? Walk as far as you want, but remember that walking is no substitute for the exercises prescribed by your doctor and physical therapist. Swimming is a great low-impact action after that a complete knee replacement. You can start swimming when the wound is sufficiently cured. What can I expect after knee replacement surgery? So you may want crutches, bars, a walker, or a cane for a while to get up. Normally, you can expect a large improvement in flexibility and much less pain in a month. It's important to exercise your knee often, to keep swelling down and also to strengthen your muscles. What should I avoid after knee replacement? Avoid putting your pants on while standing up. Use devices that help you get dressed without bending too much, like a rather, a long-handled shoehorn, elastic shoelaces, and also a support for putting on socks. First set pants, socks, or pantyhose on the leg that you had surgery on.